This week's Injury Update is brought to you by the Jacksonville Orthopedic Institute. JOI is the official sports medicine provider of the Jacksonville Jaguars.
And say hello once again to Dr. Michael Yorio from Jacksonville Orthopedic Institute. And happy Thanksgiving week, Doc.
Happy Thanksgiving to you. Thank you for having me on.
Well, we'd love to have you. And today, talk a little bit about emergency preparation in sports. And, you know, we saw this obviously last year with Damar Hamlin, but I think we see a lot of scenes, whether it's high school football, college football, and, of course, in the NFL, where from stretchers to ambulances out on the field. And oftentimes, and thankfully, it's just precautionary. But there can be in sports and in the NFL and in football in general, a lot of emergency medical situations. What goes into all that? How much planning, just even for years and years, go into what could happen in any of these games?
Sure. Yeah, at the NFL level, thankfully it's never routine for the medical staff to go out and provide emergency care like happened last year in Cincinnati. But you know, the goal for us is to, and at every NFL game, is to provide highly effective and efficient emergency medical care. So we need to be prepared for anything. You know, it's such a high-speed, high-impact sport. You can get a number of different traumatic types of injuries that can be emergent, as well as you know, heart-related conditions where there's resuscitation on the field. So from the start of preparation is always personnel, making sure you have the right people. So every NFL game has two emergency response physicians. One's on either sideline, and these are both emergency room physicians that are experienced with trauma. One typically in an event where there's a cardiac event or a major event where everyone is on the field. One would be in charge of taking care of the patient, while the other one leads the emergency response team. You also have a team of paramedics that's on either sideline, and then the team medical staff that also are there to provide support, hands for CPR or helping to move the patient. All equipment are available at the sideline, whether it be spine boards or cardiac resuscitation, medications, or airway equipment, all on the sidelines. We all practice before the season, everyone who's going to be covering a game, and this is all across the NFL. We're required to do preseason training where we all practice different scenarios and kind of work it out ahead of time how we're going to do it on our field with our team. And then communication. You know, when we go on the road, we're going to be working with new folks and new systems, so just knowing how things work. But there's a pregame meeting for all in all stadiums with all the emergency response physicians and the paramedics to kind of go over their protocols, and then they come to the pregame meeting, which involves the home and the visiting team to kind of go over what the local protocols are as far as what hospitals and where the ambulance is going to be, just so everyone's on the same page. Again, if something happens, you know, we want it to be as seamless as possible, like it's in an emergency room or in a hospital setting.
That's an amazing amount of preparedness. We're visiting with Dr. Michael Yorio from JOI here on Brighton Friends on ESPN 690, and you hit on a couple of things that got my attention. In those meetings prior to the game, I would think there's a mentality almost at that point, hey, you've got to expect the worst. It's anybody like in a first responder type of situation. I mean, you've got to anticipate the worst, or at least be ready so you're not stunned by the moment. I mean, recently there was a big, a tragic loss on the ice in Europe. We've seen other, obviously, situations, not just in the NFL, but is that almost where you have to have your mind set? If you're one of these emergency personnel, like anything could happen tonight or today?
Certainly, yeah. I mean, I think the event in Cincinnati last year with the heart issue, I mean, that went from a normal game to all hands on deck doing CPR in front of a full stadium. And the incident that happened in England with the hockey player, that's also happened in the NHL and the AHL, which is the minor leagues, for for the NHL. And these things happen. And in hockey, there's hockey pucks that are getting shot 95, 100 miles an hour and can hit you in the mouth and neck. So airway issues can become pretty go from a regular game to a sudden life-saving event. And from the NHL standpoint, it's the same as the NFL, having everyone on site locally. They have a paramedic or an emergency response physician that's right near the benches, and that they also had a cardiac event going back about 10 years ago during a game, or resuscitation on the bench. So they've kind of been down the road as well, and they go through. I'm not familiar with the specific preparations that they do, but they have all their emergency folks in close proximity to the ice to be able to provide care. Sometimes that the injury happens, and you do all you can to save the player. And I don't know the details of the player in England, the hockey player that recently died, but a laceration to the neck is a pretty scary event for everybody. But it's the rapid response by the training staff, the paramedics, the on-site medical team that does their best to save the athlete.
I probably should know this, but just out of curiosity, are these meetings that are taking place with this emergency personnel, are they just on hand for the action on the field, or would that same personnel be treating someone maybe in cardiac arrest in the stands or something like that?
Not in the stands. There's a separate emergency team for the stadium, the spectators, but certainly we have plenty of support staff on the sidelines, coaches, referees, people on the sidelines that can have an emergent event. That would be us, certainly during the game time.
Dr. Michael Yorio with us, Jacksonville Orthopedic Institute here on ESPN 690. And I guess lastly, on this standpoint, on my travels with the Jags, I feel like most places have a hospital pretty close. A lot of these stadiums are in downtown, so that would make some sense. Is that more coincidence or almost planned at these big stadiums, arenas, obviously big sports leagues, professional sports leagues, to be at least within somewhat a shouting distance in case there are emergencies?
I think it's coincidence. We're required to be affiliated with what's called a level 1 trauma center, a trauma center that can take any sort of trauma that can be that can show up at the door. So for some for some stadiums, that's a little bit more of a drive, but it's certainly within a 15-20 minute drive. We wouldn't expect anything more.
Dr. Michael Yorio, Jacksonville Orthopedic Institute here on ESPN 690. Well, I know you go to work every day, and all these folks go to work every day, and hope they don't have to use these measures, but certainly sounds like there are plenty of procedures and preparedness in place. Appreciate the time and the information, and have a fantastic Thanksgiving.
Thank you for having me, and have a happy Thanksgiving.
All right, Dr. Michael Yorio. And JOI. JOI joins us each and every week here.